Dr. Hot Flash is coming up next, right here on Arizona Daily Mix. Hi, everyone. We're back with more Arizona Daily Mix. And Dr. Angela DeRosa, also known as Dr. Hot Flash, is here. We love having her, founder of DeRosa Medical. Good to see you again.
Likewise, Catherine.
So we are talking about breast cancer and hormone replacement therapy. Is there a link, and separating fact from fiction? First, let's talk about the fact that a lot of people out there believe that it causes breast cancer.
And it does not. And interestingly, just recently, a Harvard study came out and confirmed everything we've known all along. The big 2002 study that came out that said hormones cause breast cancer, actually, they didn't tell you the full details, and the study was badly done. And in fact, even women who take the worst Prempro, which is this horrible synthetic estrogen with progestin, actually was neutral for breast cancer, and the worst estrogen, Premarin, actually lowered breast cancer risk. But nowadays, most of us are using bioidentical formulations, which have not proven to have an increased risk in breast cancer. Actually,
let me ask you about that, because I know a lot of people are concerned about those synthetic treatments, so they are going for the bioidentical hormone replacement therapy. Tell me about how that works and how it's different.
Well, the synthetics are chemical structures that are similar to what our body makes. So they're manufactured in a plant or a pharmaceutical company. They're not exactly the same. So the hormones that are bioidentical, or in other words, mimic exactly what your ovaries make on a day-to-day basis. It's identical to what we make, and it's not synthetic or chemically similar. So the body recognizes it, knows what to do with it, and it'll have less side effects from it.
So if you are a woman who's still concerned about the synthetics, is that a better alternative for you?
It is always a better alternative to give your body something it recognizes as its own. So bioidentical is most important, making sure it's not in an oral formulation, so no pills, because those process through the liver and can increase clotting factors, which do increase your risk for heart attacks, strokes, and other things. But this fear around breast cancer is largely unfounded, and unfortunately, even physicians still today largely believe hormones cause breast cancer, and the data has not shown that consistently. But the media came out and scared the heck out of women over the last decade, and has irreparably harmed women's health for a century at least coming forward.
Well, talk to me about testosterone, and how does that play a factor?
So again, we talk a lot on the show about testosterone's role in women. We make a lot of testosterone, but what's really interesting, the data actually shows that testosterone is protective of the breast. So women who have actually had breast cancer or undergoing active breast cancer treatment, and obviously with support with their oncologist, can undergo treatment with testosterone, which can help a lot of their menopausal symptoms, weight gain, fatigue, and all those things.
So even if you've had breast cancer?
Absolutely. And 99% of the time when I call my oncologist buddies and say, hey, I have your patient in my office, I want to start them on testosterone to help with some of their symptoms and their overall health. They go, sure, go ahead, start it, because they know it's not going to cause harm, and in fact, it may reduce their breast cancer risk or reoccurrence if they have had it.
Is there a woman who needs to be screened more frequently?
Certainly women who have had dense breasts or a family history, those are women we want to be a little more cautious with. The good news is actually if you have a family history, you do have an increased risk of breast cancer, but most breast cancers don't come from a family history. It's from being overweight, drinking too much wine, which we all certainly know, and all those various things, and having a sedentary lifestyle. And there's all kinds of toxins in the environment. God knows what we're being exposed to.
Well, you mentioned the family history, and there's the BRCA genetic testing. Who should have that done?
So if you have first-degree relatives who have had breast cancer, especially at a young age, or multiple relatives who've had breast cancer or ovarian cancers, you certainly want to be looking, because there's a direct link with breast cancer and ovarian cancer with the BRCA genetic coming back positive. So if you have strong histories in either ovarian, breast, and any gynecologic, I would always talk to your doctor and see if you can get screened for that, because we can prophylactically either consider removing the breasts or the ovaries as a last resort.
Do you see more and more women doing that?
We do, absolutely, because everyone is so afraid of breast cancer. And justifiably so, it's the #1 cancer that women die from, but interestingly, it's still not the #1 cause of death for women. It's still cardiovascular disease.
Heart disease.
So we need to put it into perspective. It's still important, and we need to be aware, and education is key.
Okay, especially this month. October is Breast Cancer Awareness Month.
Absolutely.
Thank you for being here.
Oh, always a
it's
pleasure.
DeRosaMedical.com if you want more information.